And welcome to the Kiosk Presents. Joining me today is Dr. Demetrius Lopes, where he's talking about World Stroke Day, which was just a couple days ago, October 29th. All right, now he's a neurosurgeon and national spokesperson for the American Heart and Stroke Association. Thank you so much for joining us, Dr. Lopes.
Thank you for having me, Steve.
Now, stroke is a serious issue. How prevalent is it in Americans of all ages?
Steve, this year we're going to have 795,000 strokes happening in the United States. Just to give you an idea, worldwide, 1 in every 6 people will have a stroke in their lifetime. So it's a big problem, and we need to do something about that.
Personally, when I was younger, I had one of my teachers have a stroke, and almost no one knew what to do. What are some of the risk factors and warning signs that people can be aware of?
Steve, that's the most important message. The American Stroke Association, and in partnership with Covidien, a healthcare product company, put together a very easy way to identify the warning signs. The acronym is FAST. So F stands for face changes, either numbness or weakness or droopy face. The A stands for arm weakness, difficult to move the arm, numbness of the arm. And S for speech, so any difficulties with expressing yourself or understanding others. These are very easy and identifiable signs of stroke that would warn us to T, which is time to call 911 immediately. And that's the single most important thing that can be done, is to identify that somebody's having a stroke and then call for help.
Yep. I know that people can lose a lot of control of their body during that time. Making sure they don't have anything to hit is also very important.
Yes, no question that having, as you call for help, you immediately make sure that the patient that's suffering the stroke is in a protected environment and until help arrives. But the happy news about all this is that we today, if we can get a patient to the hospital, we have treatments available that can make a difference and reverse the stroke. And that's maybe a big difference to what we had many years ago when a stroke would happen and we couldn't do much about it. Today, we have ways either by medications or by surgeries to actually reverse that picture. But the sooner you do, the better.
Now, we're out of Buffalo, New York, and obviously you have your own relationship with Buffalo, New York. You worked at UB in the neurological surgery department. We'd like to have someone who's had some time in Buffalo talking to us about this stuff and sharing all this information about the warning signs and the dangers. How can we get involved like you have?
Steve, I think I really love Buffalo. I think that the team at University of Buffalo and Miller Fillmore Hospital and the Dr. Hopkins, it's just an incredible team that you have locally that is very much active on this treatment of stroke. So you have today in Buffalo a great resource for the management of stroke. So the most important is that our community identifies those signs so that those patients can get to the hospital and receive the treatments as fast as possible. It's alarming to us. A recent survey showed us that only 40% of caregivers of patients that have risk factors to develop stroke knew how to name 3 warning signs for stroke. So we need to change that. I think that the more we know about the changes in signs such as face, arm, and speech, you can then help somebody you're caring for, somebody you love, and the most important is that this doesn't happen only on patients that are folks that have high blood pressure, diabetes, like you'd expect. Those are the risk factors for stroke. It can affect any one of us, from infants to the elderly at any time. And this is just key that you identify the warning signs and don't downplay them. At the moment you see changes in face, arm, and speech, you please call 911 immediately. You can make a very large difference on somebody's life.
Right. Thank you so much for talking to us today. Is there anywhere else that people can go to get extra information on this stuff?
Steve, the American Stroke Association website is a great resource. And in that website, there is a download for an app for mobile phones that allows you to see what to do, how to identify the stroke signs, as well as what to do once you see that. And there's a direct dial-in to 911 from that app also. So I think that what we need to do this week is take the time, learn about stroke, and use those resources to make a difference moving forward.
All right. Thank you once again for joining us here on the Kiosk Presents in Buffalo and Western New York.
Thank you for having me, Steve.